We welcome all of you this afternoon to South Coast Interfaith Council's Courageous Conversations Over Coffee. This is a series with the theme of growing in spirituality in the midst of the COVID-19 pandemic. The theme this afternoon is Understanding Dementia, a Caregiver's Guide. And we have with us Dr. Faisal Kazi. We welcome you, Doctor. Thank you so much for carving out this time to be with us for this very important conversation. I'm going to introduce Dr. Kazi a little bit after we have Cheryl Bentz, who is the office administrator of South Coast Interfaith Council. She will go over our Zoom code of conduct. So with that, Cheryl.
All right. Okay, is everybody seeing the screen? Are you all seeing the screen, just to make sure?
Yes.
Okay, thank you. All right, so today we're Zooming. We ask that you all please stay muted during the conversation, that it's going to be with Dr. Kazi and Reverend Jonas, and if you have any questions that you would like to ask, please write them in the chat, or you can raise your hand, which is in the participants button. There's an opportunity to raise your hand. So we're going to be recording this session, and it will be available on our YouTube channel afterwards. So your video, you will present the best if you have a light in front of you and not one behind you. So I want you to know about that tip. And please have grace with us, as you probably realize that this Zooming is an adventure, and it can be quite challenging at times. So hopefully all goes well.
Excellent. I'm seeing a lot of old friends that are on this call, so it's great to see you. I also see some new faces, so I just want to make sure for the new faces and friends, I'm Pastor Jonas Hayes, Senior Pastor of Grace First Presbyterian Church in Long Beach, and I'm also a board member of South Coast Interfaith Council. Just to let you know the format for those that are new to this, I'll direct some questions to Dr. Kazi. It'll be for about 20 or so minutes. And then we'll have about 10 or 15 minutes for your own questions. I know this is a topic where a lot of folks have lots of different pointed questions. So I want to make sure we have ample time to do that. It'll be a first come, first served basis. So if you send your question in the chat, we may not be able to get to every question, but we'll do our very best. And those that offer that question earlier will have a better chance of being able to get that question asked. Dr. Kazi, Dr. Faisal Kazi is a neurologist, and he's co-founder of the Neurology Group, one of the largest specialty group practices in the area. He's an assistant professor of neurology at UC Riverside and also Western University. He has been recently appointed on the California Commission of Aging by Governor Newsom. He's also president of Medical Network Devoted to Service, a community service nonprofit based in Southern California, which focuses on providing free of cost specialty healthcare to patients in need and those with neurological disabilities. So we are thrilled to have you with us, Dr. Kazi. Thank you so much. And I'll ask this opening question. This is kind of more of a baseline question. And that is, we hear about Alzheimer's disease and we hear about dementia often. And I wonder if you could tell us what is the difference between the two? What kinds of changes and conditions should one anticipate with both? How do they progress and manifest over time, for instance? And then if you would tell us a little bit about your own personal narrative and story about how you as a doctor have ended up focusing on this particular area of ministry, of medicine. Doctor.
Thank you. First of all, Pastor Jonas, thank you so much for the introduction, and thanks for having me, Cheryl, Amelia, and the whole team at South Coast Interfaith Council. These are wonderful conversations, and you mentioned coffee. So coffee is good for the brain. That's the current research. Next year it could be bad for the brain. So it does change every year as new information comes out. So if you have a coffee mug, it should be informal. So feel free to share your brand of coffee with the rest of us. So I want to just take your question on dementia itself as a concept. Dementia is a very broad category of syndromes, if you will. It's a broad idea. Underneath that category are different types of specific dementias. So dementia, for example, involves dysfunction in cognition. That's how we look at it as neurologists. Cognition has multiple domains. So memory, for example, is one function of cognition. That's the most obvious one because we realize when you have memory impairment, you get a immediate sense of, well, something is off. I'm not feeling well. I'd like to get checked out. But also comes along with that, sometimes detected late, is one's ability to do what we call perform tasks. We call it executive function. So dementias include some degree of executive dysfunction. And then many other things in terms of what we call thought processing. So that's your perception, reasoning, which is abstraction, learning itself, just learning new material, for example. After that comes retention, which is memory. We already mentioned that. So those are multiple domains of just dementia itself. And one of the important aspects of one of the key, after memory, I would say I would put number two, second most important aspect of cognition is language, right? I mean, language, I think many of you are ministers and you understand the power of language and how it can be used in terminology, high impact language, just language itself and what it can do to emotions and what can happen with the loss of language and what that can do to emotions. So with memory, with language, with perception, learning, reasoning, and executive function, those really 6 elements constitute our cognition, and impairments in those could be due to a disease process called dementia. Now, Alzheimer's disease is one category of dementia and happens to be the most prevalent type of dementia. So we call it sometimes Alzheimer's disease or Alzheimer's dementia. It can be used interchangeably, but at the end of the day, Alzheimer's disease is the most common form of this disease process. These dementias, specifically Alzheimer's, because that represents almost 60 to 80%, but really I think upwards of 80% of all the dementias we see in terms of our epidemiology. One of the things you notice is that these are slow progressive conditions, and we call them neurodegenerative conditions. What happens a lot of times, I get immigration forms from a lot of non-speaking families, and if their elder person in the family is about to go through an immigration test or interview, and they can't speak English, and on top of that, if they have a memory dysfunction, you have to really elaborate and explain it. It used to be that you just write in the category of in the answer, you can just say, well, this person has dementia, and you write the code that comes along with that, and that was sufficient. Last 2, specifically 3 years, the DHS immigration forms want immense amount of details about what this is, what is the process. So I just have no capacity to explain to them the whole genetics of it or the degradation process in the brain, but I keep writing that it's a neurodegenerative condition. It doesn't really have a cause per se. I mean, although we have mechanisms we understand, but we don't necessarily understand what triggers, which is what you would ordinarily consider a cause. But that's been extra work for us lately in explaining all these aspects of dementia on papers. But it's good practice. We're learning to get good at that, and this is something that comes in handy. Just basic conceptual understanding of dementias. So Alzheimer's, for example, is, like I said, it's a slow progressive process. We think that a condition can progress to the point of severe or debilitating impairment anywhere from a period of 5 to 20 years. I mean, it could be a very wide gap. It doesn't really have to be. Everything is individualized. It's everybody's body is different. Every person is different. Risks are different. but there are familial risks, meaning if somebody in the family has had dementia, there's a high prevalence within families with dementia, but you don't have to have a family history of dementia to develop one, specifically in reference to Alzheimer's disease, for example. But that's just generally how we understand dementia, and how we understand cognition, and we understand the impairment in cognition, specifically memory dysfunction, really the kind of impairment it leads to, both emotional and the kind of fear that comes from beginning to lose your faculties within the patient, and then the fear that on part of the families, and understanding that, hey, this can progress. How are we going to take care of mom or dad? We have to work, and there's no supervision at home. So I mean, there's so many social factors that go into that. Many of which I've been working with families with, in dealing with it, not just from a neurological perspective, but also social aspect of it. And thus my interest in the California Commission on Aging to be able to continue to advocate for our elderly and senior citizens. That comes that's an extension of my own professional work. And that's one of the reasons I got into this, right? So when I'm a bro and I'm a graduate of UCLA, and when I was at UCLA, neuroscience was the first year of its major, and we're talking about mid 1990s, and that was the first time it was a major. So I was technically one of the first graduating class in neuroscience as an undergrad. And then of course I went to med school, and neurology came a little bit easy, having had a neuroscience background, so it kind of naturally drifted me in that area. But if you remember, 1990s was the decade of the brain. I mean, we had an immense amount of investment and research done in the brain, for the brain, and we discovered so much more. And we have been able to do a lot for many of the neurological conditions. Dementia, specifically Alzheimer's, is still taking the kind of investment it's taking, and rightly so, but our progress there has been still very, very slow compared to the prevalence of what we see here. So you heard about stem cell research and propositions on stem cell research, the kind of money it's taking, billions of dollars from federal government, now state government. But that's what it's going to take to crack this thing. It's going to take an immense amount of resource going forward for another decade or two easily. But we are making progress with some exciting developments and research coming up. So, and my team, and we have a research part of our group, and we participate in some of those research trials as well from time to time.
Thank you, Doctor. This question really comes from, I know as a pastor, I really have seen ways that people have extended care that have been inspiring. And I've observed other cases that I think have been poor examples of care and trying to help. And so in the spirit of that, I wonder if maybe you could share with us what are some ways that family members and caregivers can be helpful as they interact with a loved one with dementia? And what are some mistakes that family members and caregivers can make, as you have observed?
Sure. I mean, so the main thing is that, as dementia progresses, your patient or your loved one is going to need more social support and more supervision even. So, and supervision is a very tricky thing to provide because most people have to work, for those who are able to get out and able to work even in this pandemic. I had a patient, for example, yesterday whose caretaker was her niece, and she worked in Los Angeles. And this patient is quite advanced dementia. She had to leave her home. So this patient would just get rides from anybody, go to a bank. So you would just go out, get outside her house, just, hail for a ride, and apparently people in that neighborhood will drop her to the bank and bring her back safely so far. But that's very concerning because we don't know what she's doing in the bank, and we don't know, she can get taken advantage of and ripped off for lots of money. But this family, has no capacity to otherwise manage, and they did not know that we can help them get resources for daytime supervision and things of that nature. So that's why connecting to a care provider is important, and many social workers that can work on your behalf. But we're seeing a lot of that, right? I mean, the kind of supervision, and I don't call them mistakes. I think people have really limitations in what they can do. I mean, they do their best for their loved ones. But we have seen stuff like, some of these elderly will turn the stove on and leave it on. It could technically burn down your house. I mean, there's hazardous situations one must really be watchful for. At the same time, I think when, so what are some of the things you can do? The whole idea, of course, in somebody who's going through this decline in their daily functions, and this is, of course, a daily impairment, you see that, the way people explain to us is that they call it confusion. Is that, I feel like my mom and dad, they're getting increasingly more confused. And we translate that as you're having lapses in memory, meaning, yes, you're having a good moment and you're having a bad moment, meaning you'll remember some things, and all of a sudden within the house you don't know what you're doing and why you walked in this bedroom to, and or you got lost within the house. As it advances, you see these issues. So I think the what we prefer, and this may not be easy to do, is we recommend family members to really be very inclusive. Get your elderly involved in conversations, in planning, maybe even planning events together. But even is it, right? Some of the websites I'll share with you later they make recommendations like doing things together, as in making a shopping list together. Just even cleaning or sweeping together. But get them involved. Their activity. Physical activity is as important as mental activity. And as far as the mental activity goes, in the mild stages, the more one can do with them, whether it's logic exercises or puzzles or, Sudoku or anything one can do to keep the juices flowing, it's always helpful. So they should just not feel the sense of isolation, that I think creates a bigger problem.
Thank you, Dr. Kazi. With this being the theme of this being understanding dementia, a caregiver's guide, I want to ask you specifically, what is it that caregivers need to understand specifically about dementia?
I think one critical thing to understand about dementia is that it's progressive, meaning there's going to be inevitably a decline in function, and it's going to be beyond memory. So I mentioned 5 to 20 years of decline. You get, dementia patients become incontinent, right? You're incontinent of urine or bowel. So the hygiene, they start losing their ability to do the basic, keep up with the hygiene. Activities of daily living, dressing themselves, eating, they start forgetting if they ate. So it works both ways. If they're forgetting that they have eaten, they'll keep asking for food, or if they just don't remember to eat, they will not ask for food. So they can lose a lot of weight. So it's really like raising a toddler. I mean, you have to have, it's a lot of investment, a lot of energy goes into, and as it advances in their daily upkeep. In the end stages of dementia, as things progress, because yes, it can start with the mild memory dysfunction, but it can get to a moderate stage where they're going to be more dependent on direction from us, more of doing their day-to-day chores for them, to the point where there's an end stage of dementia where your loved one is not eating, has no interest in any activities, barely using any language. And I saw that in my own grandfather, right? My grandfather had dementia and chose to not treat with medications. The medications have a limited capacity to help. And I saw that, when he would have his very, very old information in his head from his old routines, like he would do certain prayers, they were relatively intact till the very end. But certainly not able to do anything new, not remember, there came a point he did not remember our names, but just kind of by faces, he would recognize, okay, well, yeah, this person, I know him, he's a relative, or, my grandson or something like that, without knowing names, without knowing ranks amongst all my siblings. But then there were some things you could see I could glean in his eyes if I was to tell him a story, like, something that happened, positive that happened, that he was interested in. He would just, you'll see this ray of light on his face. And once I told him, I was invited to the White House under President Obama's last year in 2016 for an Eid celebration. And I had an opportunity to attend with a large gathering. And I came back and, and this is some years before that. And I told him that, I've been to the White House and I've had meetings there on different issues. But you could see that, he had an interest in that at some point in his life. And that was a proud moment, and I could glean that, So family members are, and just how I experience it, I think you'll see family members will be able to tell you that, they do see that sense of a reflection in them. They recognize, so they are processing some information. It's not going to be processed like a normal person, but you can continue to give them that emotional support, that emotional help, that positive news from time to time about your success or other successes or other good things. I mean, you don't want to stress them out necessarily, right? And then one thing that that families can do is really maintain routines, as many routines as you can maintain. If they take a walk in the evening, ideally they should continue to take a walk in the evening. And that physical activity is really crucial for mental, for the mental capacity as well. So, but routines are really, really important at the end of the day.
Thank you, Dr. Kazi. I want to bring out some of the questions that are being asked in the chat box, and I'll save my question for maybe toward the end. But Dale Kornman had a question. Has the fear of COVID and lockdown increased the cases of dementia?
Yeah, I mean, that's a good question. I wouldn't say that the lockdown itself is increased, because the lockdown it's just it's a social structure. The dementia itself is a disease process, so you're either at risk for it or you're not at risk for it. Or if you were to develop it, you would develop it gradually. So you could have a patient that pre-pandemic was showing signs, and then you just are seeing more signs that are more evident, and then it's establishing the diagnosis of dementia post-pandemic months. So it doesn't mean that pandemic itself has anything to do with it. It's just that, hey, this is a spectrum, a gradual progression of the spectrum that is coincidentally aligning with the changes in the social circumstances. So that's one way to look at it. But the lockdown itself has created a social problem, right, in itself, because now you have a lot of our elderly are at nursing homes. Access to nursing homes in the lockdown by two family members is very limited. I just saw one, because as you know, a lot of the nursing homes and care centers, they don't have to be nursing homes, but assisted living facilities, they're not allowing family members to come in and spend time, because we know that nursing homes and these facilities are the hubs for rapid COVID transmission. So of course those precautions have to be rightly taken, and some of those mandates and guidances are coming from the state, and these homes are complying. At the same time, there's a need for connecting with your loved one who's over there. So of course, Zoom and apps are used. I know some nursing homes have difficulty figuring out how they can receive a Zoom call from an outside, because there's a HIPAA compliance, privacy issues. So I know some nurses were just using their personal phones. Some nursing homes got some devices that were designated for that nursing home itself. And then there's other companies that are making apps. There's one that I was just told about today. It's called eLoveE. And it's an app, but now they're trying to create a three-dimensional virtual platform, meaning you would be as if you're sitting in the room with your loved one. So look, technology is, it's at a point where it's going to leapfrog into meeting the social needs that are emanating from this pandemic at much more rapid phase than we would have expected, which is a good thing. But at the same time, it doesn't negate the fact that your loved ones in dementia that are in that increasing isolation are struggling with increased depression, increased anxiety, low mood, low physical functioning, and all that has a negative effect on the already existing dementia.
Thank you, Doctor. Cheryl Bentz has a question that she said, I was surprised to learn that a urinary tract infection, UTI, can greatly impair a dementia patient's cognitive ability. Are there other conditions that also affect dementia?
Yeah, so when you have a baseline dementia, what we call, think of it as there's a term that an old neurologist used called beclouded dementia, something that would cloud your dementia further, right? In the hospitals, we use the word delirium sometimes to describe a change in behavior. Sometimes we use the word encephalopathy, that's a technical term. All that means is that your brain functioning has taken a dip. Basically, you're more confused. One is more confused, more lethargic, less arousable, less verbal. So there's an overall decline in the functioning capacity in dementia patients. any infection really doesn't have to be a urine infection. Technically, any infection can tip this balance over, and the patient can get into that behavioral change called encephalopathy, from whether it's pneumonia, urine infection, infection in the blood, so anything to do that. But also, tiny strokes. Doesn't have to be a very large stroke. A tiny stroke sometimes tips this over. Any change in kidney condition or liver condition, liver function or kidney functions can create similar problems. So what we call metabolic functions and functioning of other organs can also throw off one's mental faculties further beyond the level of dementia. Now, once you treat those conditions, and if you can bring them to baseline, you could bring the patient to baseline, but that takes a very, very long time. And a lot of times the patients do not go back exactly to their baseline. They'll operate at some degree of increased impairment compared to before. And the last thing I would mention is brain injuries, because a lot of our elderly fall. Or a dementia patient who falls and hits their head, you see people come and describe to us that, hey, since the fall, their memory problems are far worse. So now you have dementia, but you add a concussive effect, what we call post-concussive effect on top of that. You'll see another level of decline. And a lot of times you don't get back to baseline, your original baseline. From that, you have a little bit more impairment of varying degrees beyond the existing dementia. So that's how it just continues to progress. And I think, and let me know when to bring it up, I wanted to mention something about vascular dementia. Somebody had a question earlier on vascular dementia. So vascular means, of course, vessels, something to deal with vessels. Vascular dementia is really a result of repeated strokes. So if somebody has repeated strokes, and unfortunately we have patients that have significant vascular disease for genetic reasons or whatnot, and they have multiple strokes. Some come in with 4 or 5 strokes over a period of a decade, and those strokes can be different parts of the brain. But overall, they start disrupting the fibers and connectivity and processing in those different regions, and ultimately the cumulative effect of that is overall decline in your cognition. The only distinction is that, as opposed to a progressive, slow progressing dementia like Alzheimer's, this is what they call gradual or stepwise, meaning you have one stroke, you have an impairment, and another stroke will compound that impairment on top of that. Third stroke will, so it will just keep getting compounded in a very stepwise, event-based format. So every time there's a stroke, it's just gonna exacerbate the cognitive decline, and then stop at a certain level until the next event hits you. So otherwise, Alzheimer's dementia, the most common type of dementia, will continue to slowly progress over time, over months to years.
Thank you, Dr. Kazi. Liz Wood is asking, what is the percentage breakdown of people with dementia in various age groups?
Yeah, that's a good one. I mean, that's how we understand. So usually a lot of the dementia we describe is over the age of 60, 65, right? So I mean, you have under the age of 60, the prevalence is very, very low. Over the age of 65, and let's just say, over the age of 65, let me just throw these numbers and we'll look at different papers. We'll have a sort of, variation on this theme, but you really generally see maybe 3% or so. But what's interesting is that between ages 70 to 79, you have a prevalence overall of 5%. That's usually what we when we say dementia's overall prevalence globally, we say there's a prevalence of 7%. But what you're talking about really is 70 to 79 of age. We see that about 5% is the general of the population may develop dementia. What dramatically changes after the age of 80 to even 85 is that it really, increases multifold. We're talking about, 25% to 40%, very, very large numbers. So the idea is that the longer we're living, that degradation process in the brain is actually, just continuing to work, and then the degradation products are accumulating, they're disrupting your brain cells, they're damaging the brain cells, and you see the impact of that in the form of dementia. So basically, bottom line is that half the dementia patients will be naturally over the age of 80, typically speaking.
Thank you so much. I've got a question here, and This is one I've heard a lot, I have to say, as a pastor, from church members. Uh, Reverend Stephen Marsh had shared that his mom, deceased, had Alzheimer's and diagnosed at 65. His dad, now 87, was diagnosed with Alzheimer's at 84. And might you expand on genetic issues and what he might do now at 63 to be preventative?
Right. Well, so prevention is key. We're at a point in our in our development of our medical understanding of many diseases, including cancer, that they are preventable. So what can what can go in the form of prevention? Well, when you think about it, just general healthy lifestyle, right? If we're able to continue and have the capacity to physically exercise. By the way, now they say the World Health Organization's guidelines on cancer prevention are very heavy on physical activity. And the same goes now, as we talk about dementia prevention, physical activity probably has a very, very primary importance. So daily routine exercise over a long period of time, I think is crucial. So that's one thing. Of course, with the brain, the brain, you have one distinct advantage is that you can actually increase your brain reserve overall, right? So what does that mean? It means that, we can continue to challenge ourselves. Of course, brain, think of it as a muscle. The more you use it, it's not a muscle, by the way, but it's a bundle of nerves, right? But the more we use, the more capacity it develops to, it's called plasticity, the more capacity it develops to retain, reserve, and process information. So I would say that, logic exercise, we're actually talking about, Stanford developed this model for video games for elderly, right? So as you get older, video games with its ability to help you with coordination and just processing, rapid processing. So even that has a benefit in it. I think a healthy diet is always good, right? So one of the things you notice that a lot of our dementia patients get put on Lipitor or something like that as an anti-cholesterol medication, because we have not only has benefits in terms of modulating, the health of the brain and tissue and the vascular tissue, but just keeping your cholesterol low. So low cholesterol diets, generally speaking, which is where also physical activity really helps. And I think if anybody is really interested in just vitamins, I think vitamin D is emerging as, although in the research is not, it's not something that that's definitively proven as the preventive agent per se, but I think vitamin D as its antioxidant effect, anti-inflammatory effect, in a number of conditions is emerging as a very important vitamin to consume. So I'd say this physical activity, increasing your mental capacities by doing the extra bit of coordination activities or logic exercises, or when challenging oneself, and also natural supplements and diet and exercise.
I've got two different questions I'm going to work into this that are similar from a couple of people that have directed this my way. So are there medications that can slow down either vascular dementia or gradual progressing dementia? And I have a specific question about the supplement Prevagen.
Yeah, that's a good question. So the medications we have are of two different class of medications, two different categories of medication. Unfortunately, that's all we have right now. And they're not curative, meaning they themselves are not a cure, but they do slow down decline in one's cognitive capacity, say memory, for example. Donepezil is a very common one might have heard of. It's a generic drug. Memantine is another one. Those two are used in combination because they work synergistically together. And but that's really all we're working with. We are coming up with, there's active research going on what they call scavenger drugs, which are IV infusions that are giving IV or injectables. Their role is going to be to pick up and clean out these degradation products, the proteins that degrade in the brain. When these proteins accumulate in the brain, they cause damage, resulting in Alzheimer's and cognitive decline. So those medications, they hit a bump. Yeah, there's a lot of side effects from that. So some of those studies were stopped. They're making a little bit of a comeback. So there's some promising ideas out there. For now, unfortunately, nothing that's can cure it, but yes, it can slow down a little bit, and that just really depends on individuals. I think a lot of these medications work up until the moderate stage of dementia. Once you get to advanced stages, they really become, in a way, not useful. So we start terminating them from your regimen. And Prevagen, so there's a couple of natural supplements, right? One is called Focus Factor. Prevagen is emerged as one of them. They tend to be cocktails of multiple vitamins. And they're worth trying. Of course, for dementia itself, they're not likely to do anything once the dementia is diagnosed and set in. But for more milder forms of impairment, memory impairment, when there's a category we call mild cognitive impairment. And it's just, because as we age, you have some forgetfulness. And it's not bad enough to have significant impairment on your daily functioning, but it's something that, makes you write things down. It just, you have to learn to figure out your appointments, but it's not really, you're not dependent on anybody. It's not that significant of an issue, and it's not really crossed the threshold for dementia. So we call it MCI, or mild cognitive impairment. So in a lot of my patients who have mild issues, I do recommend, try these natural supplements, whether it's Focus Factor or Prevagen. The thing is that for any of these natural supplements, you have to try them for months, 2 or 3 months easily, before you know if it's doing anything for you or not. Because we don't have studies on these. These are not formally studied, so we don't know the biomechanics, so on and so forth. So it's worth trying it long enough. I've had mixed results. It's worked for some of my patients. Has not worked for some of them. So, but if its symptoms are mild, it's worth a try.
Thank you so much. I have one more question I'm going to ask from the chat box, and then I'd like to ask my kind of closing question before we close out our session today. And one of our board members, Marietta Fong, is asking, what are some of the latest research developments that you think are most promising?
I think we're heading in the right direction with the scavenger drugs, and I'll leave them as a broad category. I mean, what we need to do is we need to figure out a way that these proteins that degrade in the brain, I mean, these are naturally occurring proteins. It gets to a point where they start degrading in the brain and in the brain tissue. And when they start degrading, they become abnormal in form. We call them tangles or plaques. And then they start accumulating in one's brain cells, and then the brain cells die as a result. So that creates a lot of that dysfunction that we see clinically. So the ultimate goal, if these drug products, the so-called scavenger drugs, that can sweep these up in time, I think we will make a pretty dramatic change there. So that's where I think a lot of it's headed right now.
Excellent. So before I ask this final question, I know this is really a difficult topic and a painful topic for many people. And I think everybody has experienced somebody close to them, a family member that has battled dementia, Alzheimer's disease. And but with that, I do want to ask, what are some examples, or what are some things that you've witnessed as far as blessings, gifts, and silver linings that you've witnessed of someone caring for a person with dementia? Are there any kind of memorable stories that kind of come to the surface that you might be able to share with us?
Yeah, I mean, the one thing I would just say is that, family, I have a patient who has the kind of dementia. It's a rare type of dementia, much less prevalent than Alzheimer's is what I should say. It's called frontotemporal dementia, where you lose your language function first. But if you lose your language function, you're unable to talk and do not have the words to express, it is really a frustrating position to be in. And the way the family of this patient has come together and supporting her and brought all of them together is really incredible. And I think that you see this example again and again, with the family members, loved ones, husbands caring for their wives or wives caring for their husbands. And that's really the key, is to really break that social isolation and come to realization that this is a condition that's going to require really a village. It's going to require a whole system to care for. And one thing I tell families is that don't think, definitely don't feel that you're alone. There are resources. You can look at the Alzheimer's Association. You can call the Alzheimer's Association. They have plethora of information. They can find resources. There's also one of the things I'll be advocating in my role at the Commission of Aging is really we need to see more memory care centers, right? For a lot of so the family members can do what they need to do during the daytime, and the elderly are cared for. And you see some increase in memory spas. These are very active places where our patients can go in and interact significantly. Of course, this is going to be, I think, a lot of post-COVID effort to scale those up. But again, I think just a short answer to your question is that family and friends. I mean, ultimately, that's the only way to get your loved one through this difficult phase of their life.
Thank you so much, Doctor. I know there were some resources and websites and such that you wanted to share with us. Now would be a good time to offer those.
Yeah, if you don't mind, I'll just post a couple on the and the chat box, if that's okay.
Sure.
But one resource, if everybody can remember, is definitely Alzheimer's Association, the local Alzheimer's Association. So please keep them in mind. There's chapters everywhere, really. And I'm gonna just cut and post something here, see if you guys get it. Oh no, it didn't come. Sorry. Let me try again. This one did not come through. The website I would refer you to is alz.org. That's a very good website. So think about that, and I'll see if I can post this here.
Oh, great.
Or otherwise I can email. Yeah, for some reason it's not letting me post. Yeah, alz.org, you got that, Amelia, thank you for that. So that's a very good resource right there. So they have a help section that gives a lot of information. There's a alzsd.org as well. That's a local chapter. They have some home activities one can do together. alzsd, S as in Sam, D as in dog.org. There you go. So those are really good to look at. And the Alzheimer's Association itself is a good group to call anytime something is needed.
Excellent. Thank you so much. Let's give them a virtual hand here. A little clap or an emoji, a clap like this. Thank you. This is so kind of you to spend your afternoon with us, and really a lot of excellent information and from the heart. So thank you for being here with us.
Absolute pleasure. Thank you.
Let's see. I think in closing, I just want to give our executive director of South Coast Interfaith Council an opportunity. If you want to say a parting word, Milia Islam Majid.
Thank you. Thank you so much, Jonas. Thank you, Jonas, for taking the lead on this program. This courageous conversation started, I think our first one was at the end of March or April. We went from weekly to now monthly. So I really appreciate Jonas and Marietta and Cheryl for taking the lead and continuing these conversations. I think and Faisal, Dr. Kazi, of course, thank you so much I know it's been an incredibly busy time for all of us, and we really appreciate this. And as you can see by the interest, and this will be posted on YouTube, and we'll share it with those who registered. Obviously, it's something that is prevalent and affects a great many people. So we really appreciate the time that you've given and the knowledge that you've shared. Cheryl, I'm going to ask you if you could share. I think we have 2 upcoming flyers that we would love for you guys to join us for these programs. On November 11th, we have Armistice Day, which is essentially a day of peace, really, a day where we honor the veterans who have fought, but we also advocate for the importance and the need for peace in our world. And the South Coast Interfaith Council, along with the Long Beach Peace Network and Veterans for Peace, want you to take a moment and to recognize this day on November 11th at 11 a.m. There will be people who will be ringing bells, whether virtually, whether symbolically, or whether with an actual bell. So we ask you to just recognize this day and participate on this day. Take this to your faith communities and have them be also advocate for it as well. More information can be found on our website about this as well. And then on November 15th, I believe, is the next program. So this program, we really wanted to have an opportunity to, over some of the programs that we've done this year, we've engaged with so many people, and certainly one of the groups that we've engaged in that we've learned such a great deal from is the Native American, faith group and the Native American traditions. And so we wanted to have a day where we wanted to kind of honor their thought process, their perspective, what their, as we face the challenges that we're facing right now, what we can learn from them and the wisdom that's embedded within their traditions. And so we have two very, very important people who will be joining us for this program on Sunday, November 15th, 3 to 5 p.m. It'll be teachings from Sister Tina Calderon of the, it's the Gabrielino Tong, I think it's Tongva and Venturno Chumash nations, as well as Chief Eagle Warrior Daniel Ramos. And if you were part of the gala, you saw that he, or if you watched our gala, he provided a beautiful opening prayer for us. So we invite you to just learn with us, to bring your hearts and your minds and your spirits together. And it's just a program of engagement and learning from each other. And I think lastly, of course, if you're able to, we would love for you to support our council. Thank you for those of you who do. All these programs we do are provided free to everyone. And we hope to continue that as we start another year of most likely virtual programs. So you can go on our website and donate as well. And I think, Jonas, I'm going to pass it back to you. We do have programs lined up for the Courageous Conversation for December and January. So I can talk a little bit about, January, let me wait until I confirm that. But I think for December, Jonas, if you want to share a little bit about that.
Yeah, for December 4th, that's the first Friday in December at 3 o'clock, we will have with us Stephanie Rivera. She's the community engagement editor for the Long Beach Post. Previously, she had been an immigration reporter, and that was her area of focus. But she's recently transitioned to a new position. So it'll be great to have her with us. And so if you would put that down on your calendar, if you're able to attend, it'd be great. Only other thing I could think to share is you guys have, South Coast Interfaith Council has started a new program too, where you can give through a text to give. So I don't know if you wanted to share that too. I think that's a great new program. That
would be great. Cheryl, do you have that image by chance? If you don't, I can look it up real quick and show you. Maybe while Cheryl is doing that, I do want to give, basically what we'd like to have in January is that we're working with CASA to talk about advocating for children in the foster care system. One of the things that the pandemic has done is there's been a great increase of domestic violence, but also child abuse as well. So what social workers are finding is that there's more and more children that are going into the foster care system, but they need help in regards to having people to foster, people that will foster them. And so we're reaching out to the faith communities to play a role in that, particularly at this time. So we'll have someone who will talk to us about what's going on and the trainings that are available for those who are interested in partaking in that process. And Cheryl, I don't know if you were able to pull up our, yay. So yes, so there's 3 ways to give. What Jonas, and thank you, Jonas, for reminding us about that, is our new text ability to donate. So all you have to do is just text HELP SCIC 2 the number 44321, and that will take you to a site that you can make donations all over your phone, or of course on our website, or you can send in a donation at 759 Linden Avenue, Long Beach 90813. So thank you all so much. And Cheryl or Jonas, if you have any other concluding words, then
I think that wraps up our time. So thank you, everyone. And I'll just say to go in peace and have a wonderful weekend.
Absolutely. We'll see you next month. Thank you, Faisal. Thank you, Dr. Kazi. Thanks, everyone.